today's topic is surrogacy issues and perspective in Indian scenario. We have divided the topic into two parts. Our gynecologist, Dr. Lahiri, he will speak on the technical aspects of assisted reproductive techniques and various types of surrogacy, and later on I will discuss regarding the administrative issues of surrogacy, what are the things, pertinent issues nowadays. So without wasting much time, I request Dr. Sengupata Lahiri to come to the dais and start his talk. Dr. Sengupata Lahiri, please.
Surrogacy is a very important topic in current times. It is a lot of medical-legal implications and also emotional aspects.
Good morning, Madam Mitra and all my colleagues. So today we will be discussing on an important burning topic, that is surrogacy, which is gradually increasing. Because as you know, the infertility is also in a rising trend, because the ladies are now more of career oriented now. They are marrying very late, and even few are also not taking their pregnancies early. So the infertility has become a very burden to us, especially in gynecologists. More or less, ART has come also in a big way, but success of ART ranges between 25, 35, maximum 40 in best of centers even in the world. So even if you go, the ladies are going for these ARTs, there are still some 50 to 60% infertile couple who are not getting pregnant. So this surrogacy has come a big way, especially in Western world and also gradually in India. Surrogacy, in one word, in just in a layman term, you can take as a womb harrying. You are harrying a womb for time being for 9 months to rear the child, and after the birth, the baby will be given to that couple, and the lady will go away without keeping any notice of that lady who has taken pregnancy. So Dr. Sengupata has told me that yesterday only. So I thought let us, it is a good topic, and I also have not much knowledge, so I tried to summarize within 10-15 minutes, and he will detail because ethical problems and legal problems are much more important than this here. This is actually more or less a ART procedure which is advanced to in different set, but ethical problems and legal problems are so much, so sometimes it is very difficult. So he will give in detail on about legal and ethical problems of surrogacy, and I will just touch on some important points of surrogacy. So what is the meaning and reasons of surrogacy? Surrogacy is a method of assisted reproduction whereby a woman agrees to become pregnant for giving birth to a child for others to raise. So it is not hers, but she agrees. In lieu of that, she takes money, whatever may be, or financial or something, whatever may be. That lady may be related to her, that couple, or unrelated also. That is depend upon the. So for that reason, that woman may be the child's genetic mother, or may be implanted with an unrelated embryo. Even sometimes this father may have a less sperm count or something, or even the ovaries may not be producing the ovum. So even the ovum may be of some other origin, the sperm may be of other origin, and even everything may be of unrelated embryo. So everything can be possible. So I will come in detail slightly. So surrogate actually is a Latin word which means appointed to act as a place of. So usually it is broadly in two types. One is acoustic and is commercial. Now mostly these are commercial because of different combination possible. But acoustic is actually the semen of that husband and ovum of that lady They are fertilized in artificially, that is like a ART technique, and this is implanted in the aging lady. So that is altruistic. And when other combinations will come, so they have given as name as a commercial. So why there is surrogacy? What is the reason of surrogacy? Why it is come? As I told, the woman intends to become parent. Either they are all infertile, of course, and they are unable to carry the pregnancy or term. So maybe she have a hysterectomy for some other reason. Maybe she had uterine malformation leading to recurrent pregnancy losses, she is not getting, or any serious medical illness for which pregnancy is contraindicated. Suppose a severe congenital heart disease, pulmonary arterial hypertension, or Eisenmenger complex, anything which medical illness is making her pregnancy very difficult or risk for her life. In that case, a surrogacy can be advised. And sometimes these are a female fertile but healthy but unwilling to undergo pregnancy. Sometimes they know they are afraid of pregnancy. In those cases also, that surrogacy can be of possible. So these usually are these like ladies with different complications like fibroid, very big fibroid, repeated fibroid. You have done twice or thrice myomectomy, still she is not getting. Even malignancy, even septal uterus, etc. And the ovum of these in these ladies, the ovum of the woman is taken and is fertilized by the semen of the husband in the laboratory like ART technique, and then is implanted in when it is to some other woman. This lady is called a surrogate mother, that I already told. So this lady is not the biological mother but delivers the child. She returns the child after birth to the biological mother. So mother is separate, but this ovum and sperm is fertilized outside ART technique IVF. So it is introduced to this surrogate mother in proper time in IVF laboratory, and this mother nurtures the baby for 9 months. All the pregnancy cares, everything is taken, and after the birth, it is handed over to the biological mother. So this is actually true surrogate mother. Then surrogate parenting actually was another term. It involves a woman bearing the child of another woman who is not in a position to bear the children as a result of blocked fallopian tubes and or lack of a tube. Same thing. Actually, the parenting, there's another word they are using. Same thing, because of tubal problem or lack of uterus, maybe congenital absence of uterus, but ovaries are up and like Rokitansky syndrome. That is also a one congenital idea that when uterus is absent but ovaries are very good, ovaries are normal. So in those cases, surrogate parenting is a possibility. Similarly, in these rare cases like gay male couples, they may choose some surrogate mothers to have their own child. At least half of the child is yours. There's at least one partner is biologically related to the child. So gay male couples can even go for surrogate parenting. Then who might opt for surrogate? Some implication actually. I will replicate miscarriage. I already told pelvic disorder, dangerously high blood pressure, heart conditions or liver conditions which entails the females to take a pregnancy. And similarly, sometimes people speculate that women taking part in surrogacy arrangements, although capable of bearing a children themselves, because they wish to avoid the physical, social, and psychological or financial drawbacks of bearing, so they also go for surrogate. Then, what are the criteria to become a surrogate mother? So, who can become a surrogate mother? So, the lady who becomes surrogate mother, she must be in overall good health, and she must not be primary, because primary pregnancies are more complicated usually. So, they must have their own child, at least one own child. Number 2, and she should not have any other medical illnesses, severe any medical illnesses, or any other things. Or like other Western countries, heavy smokers, drinkers, substance abusers. So these ladies is not a fit case for surrogate mother. So must be having own child first of all. Then no other medical or serious illnesses or any other illness which may contradict the pregnancy, again problem, and any other like substance abuse or these things. So and number 2 is she must be emotionally and physically in a demanding task. She must be emotionally fit. That suppose she has taken the issue and then after that she may be emotionally bonded with the child, she may not give it, she may become psychologically problem. So she must be emotionally okay, ready to give the child after the delivery. So that was very important. So counseling part is most important in the surrogate mothers. So it is important that women considering this option as a backing of a partner. She must have a married actually or partner or something at least, and family and friends to provide you emotional support, because this is very important. Otherwise, she may have again, because after the delivery usually lady may have a attachment. Then so this has to be taken